Good afternoon, everyone, and thank you so much for joining us today for our health talk. We're going to hear Rachel Elek talk about life after cancer, mindfulness, and meditation. And I will just to give you a little background about Rachel. She began her career as a social worker and clinical liaison for Seasons Hospice and palliative care on the south side of Chicago. In June of 2011, she relocated to Altman Hospice and palliative care and received the Rising Star Award in May of 2012. Rachel worked with the hospice program until February of 2019 when she came to the Altman Cancer Program and continues to serve as the oncology social worker. Thank you so much, Rachel, for being here with us today, and I will hand it over to you.
Okay. Well, thank you so much. And again, my name is Rachel Elek, and I'm the social worker here at the Altman Cancer Center. And I will talk first and talk about mindfulness, and then Al will come after me and talk about meditation. So we'll just go ahead and get started. Mindfulness was something that was a little new to me when I first started looking into this probably a year and a half ago or so. And it was just a concept that now makes sense to me, but I wasn't exactly sure what it meant back then. So it's just a good thing to kind of be aware of and maybe put into practice yourself if it's something that you're interested in. Sorry, I'm having trouble advancing my screen here. Oh, there we go. So what is mindfulness? As defined by Psychology Today, mindfulness is a state of active, open attention to the present. This state is described as observing one's thoughts and feelings without judging them as good or bad. So you're making a conscious decision to focus on something. And that could be breathing, it could be coloring, it could be walking, reading, even eating, just anything that you have interest in, but just trying to be present in whatever that is that you're doing. Mindfulness doesn't have to last a long time. It can be a minute, 3 minutes, 10 minutes. I don't know that you can do it for an entire day, but it's just kind of focusing in to help clear your mind for a set amount of time. Our minds wander frequently, so just giving yourself a gently noticing that and just kind of bringing yourself back to what it is you're trying to focus on is kind of the concept of mindfulness. So again, it's just awareness and acceptance. We notice, observe, name, and accept whatever it is that we're involved in at the time. So not intended to block out unpleasantness in order to relax, which is, like we said, impossible kind of for anyone to do. But you're fully experiencing a moment, trying not to say good or bad, judging it, but you're creating a positive outcome for your own well-being. And again, our focus is sort of after cancer, even during cancer or during anything that's stressful in our lives. It's just trying to accept and be aware of that. As we know, with any stressful situation, especially cancer, there's constant change. So it's trying to embrace that change and uncertainty to help you along that journey, to be able to not feel as overwhelmed and feel anxious about the stress that is bringing to you. Just acknowledging that and accepting it and helping yourself to move past it can make you feel a little more steady. So mindfulness truly is a tool to empower yourself to use your body and mind in very practical ways to increase your overall well-being, like we said. So the goal is to empower you to stay more engaged in your life in a healthy way, so you're not focusing on the negative. And breathing is proven to help and engage the sympathetic and parasympathetic nervous system. So when I looked into this, the one thing that I liked is learning about this vagus nerve. It was something that I was not aware of as a social worker. I don't really study the human body in depth in any way. So this vagus nerve is the longest nerve in your body. It connects from the top of your head down through your digestive system, and the nerve helps move us from sympathetic to parasympathetic. So to define those two, the sympathetic nervous system activates our fight or flight response during a threat or perceived danger, or if we're anxious, in any situation that we might be facing. The parasympathetic nervous system restores the body to a state of calm. So it's moving from that panic back to feeling calm and in control. So when we focus our breathing, and you think about the breath coming into your nose, it allows your mind to have something to focus on, and thinking about it traveling through your system. This is part of mindfulness, and just thinking where that air is going and how it's coming out. It just helps to calm yourself and calm your whole sort of nervous system. And I like this next visual here. This is kind of a picture of that vagus nerve, as the longest cranial nerve that we have runs directly from the brain all the way to our tailbone. So when you breathe from the diaphragm, it puts pressure on the vagus nerve and creates relaxation to your parasympathetic nervous system. So as you can see all the things that it affects, you can kind of understand that as you're taking deep breaths and letting that air move through, you can feel more relaxed, and it does help to restore your system. Research shows that 20 minutes of diaphragmatic breathing is all that was needed to activate and oxygenate that mindful thinking part of the brain, and get kind of things moving to where it needs to go. So when we feel those high levels of fear, anxiousness, tightness in our chest or neck, belly, rapid heart beating, engaging that vagus nerve can help calm all those areas. So diaphragmatic breathing is intended to help use the diaphragm correctly. It strengthens the diaphragm, decreases the work of breathing by slowing your breathing rate, decreases oxygen demand, and uses less effort and energy to breathe. It also gets the serotonin moving in your system to where it needs to go. So mindfulness has lots of benefits. It can reduce the negative emotions that we might be feeling. Focusing on the past is a symptom of depression, and focusing on the future is a symptom of anxiety. So mindfulness is helping ground us and focus on in the present, in the moment. So not to say that we won't have those feelings that are overwhelming, but it's a practice to help try and control that. Because sometimes, depending on what folks are facing, you can really feel overwhelmed in a moment or even for a longer period of time. And this is to try to help ease you through that, the practice of mindfulness. So it can really boost your health and increase your immune function, increases your happiness, decreases that depression and anxiety and stress that we're feeling in our lives at times, can make you feel a little bit like you want to be more social. Sometimes we don't feel like doing that when we're going through harder times. Boost your self-control, just improves your productivity, makes you feel kind of like you're more engaged with your mind and body and not feeling like you just can't sort of function at times. I like this visual because it really shows us what we're aiming for. We don't want our mind full of things that are going on. We want to have that clearer image on the right side where you're just looking and observing kind of your surroundings, taking in the moment and not letting those moments pass you by. So there's lots of ways to practice mindfulness. Meditation is one. We'll hear about that later. Sometimes mindfulness is not a spiritual thing to do. Certainly you can incorporate your spirituality, whatever that might be. So contemplative prayer. Sometimes people enjoy being at Christian prayer services to help feel centered. Some people use a rosary when they're praying. There's the Jewish Shema and Islamic Sufi, which I think I'm pronouncing correctly. So there's all sorts of things in different religion and faith traditions that people can use and incorporate when they're doing their acts of or their practice of mindfulness. Also, certainly there's mindful movement. There's things like yoga, martial arts, dancing, even hiking, horseback riding, walking, any of those things, just trying to focus on what you're doing in the moment, like on a fall day, walking in the woods and observing the colors and all those kinds of things can help make you feel centered. So there's a theory called dialectical behavior therapy, which looks at this model of this wise mind. And so there's basically three states of mind that we can be in, sort of the rational mind, the emotional mind, and the wise mind. When you're operating in this rational mind, you're often approaching things, observing facts and making decisions based off of that, not necessarily putting emotion behind those things. And then the emotional side is you're kind of reacting in the moment, using those emotions to drive your decisions, not necessarily using logic in those situations, a little more reactive. Can tell you how you're really doing, though, in some situations. So that's a good thing. But the wise mind, which is kind of the combination of the two, is you're thinking more intuitively, looking at both of those things and making the overall better decision, not necessarily maybe what you want, but what's in the best interest for yourself or for those around you. So it's just kind of mindfully thinking through decisions and how to proceed forward when you're faced with whatever it might be that you need to make a decision on. All right. So I have a couple of mindful practices that are simple little things you can do. And I was going to walk you through there's 4 practices here. You can close your eyes, turn your screen off, whatever you want to do, but it's simple. And I'm going to allow a little bit of space and time for you to just think into yourself of how you'd respond to some of these, or some of them are just asking you to kind of put yourself in a certain situation. So the first one is called the 5-4-3-2-1 method. And I like this one. I've used this one with my kids actually when they're panicked about something and they just feel very overwhelmed in the moment with an emotion. So 5-4-3-2-1 method again. So the first thing is you say to someone or yourself, think of 5 things you can see right now where you're at. And then we go to 4. 4 is think of 4 things you can feel or touch right now. And then 3 is 3 things you can hear. 2 is 2 things you can smell. And 1 is 1 thing you can taste. So this is a simple exercise to use your senses to try to bring yourself to a calm situation if you're feeling overwhelmed. And those are things that you can identify no matter where you're at. If you're in a busy city or if you're in an office or wherever you're at might be, even a family member's house, you can identify those things to help kind of calm yourself and bring yourself a little bit more grounded in the moment if you need to. The second one is called squared breathing. So here you inhale for 4 seconds, hold your breath for 4 seconds, and exhale for 4 seconds. So I'll go ahead and just walk us through one round of that. So we're going to inhale for 4 seconds. 1, 2, 3, 4. Hold for 4 seconds. 1, 2, 3, 4. And then exhale for 4 seconds. 1, 2, 3, 4. And again, you can go through that as many times as you need to, or many times as you feel to get yourself calm or settled if there's something going on. Sometimes we just need that simple guidance of a set of 4 to kind of get us going. It's simple, but it really does work in the moment if you're feeling overwhelmed. The third is called, Is This Wise Mind? So if you find yourself about to do something that you might later regret, you notice it and you pause. And as you pause, you take a slow breath in and ask yourself, is this action or thought truly wise mind? And then you listen for the answer. You don't tell yourself what you want the answer to be. You just sit until you feel like the right answer naturally arises to you and you understand what you need to do. So you pause and you breathe and you notice what answer presents itself to you. And then it's up to you how you respond in that moment. So, again, just a simple little way to kind of walk yourself through a situation. And then the last exercise is called stone flake exercise. So I will ask you to close your eyes because I'm going to kind of give you something to visualize. And I really like this one because it really does kind of help you visualize a calm, relaxing place to be. So if you close your eyes, imagine that you are seated next to a crystal clear lake on a beautiful sunny day. Imagine that you are a small flake of stone chipped from a much larger rock that someone has gently thrown out into the center of the lake. You are gently floating there on the placid surface of the still water. Now you begin to gently and slowly float downward in the cool water toward the smooth, sandy bottom of the lake. Notice the look and feel of the water as you gently float to the bottom. Notice the feel of the smooth sand as you lightly rest upon it. Become aware of the peace and serenity at the bottom of the lake. This deep stillness and serenity is the calm center of yourself. Allow your attention to settle into this calm, centered place within. So as you can see, that's an example of an exercise where somebody walks you through something to visualize, which there's all kinds of ways you can do that. There's a lot of apps on phones that you can download and get that do mindfulness exercises that can kind of walk you through those things. Even the smartphones, smartwatches have settings that will remind you to do mindfulness throughout your day. So there's all kinds of things, like we said in the beginning, even coloring or anything can really be a mindful activity for yourself and help you feel centered in the moment when you need that. So I'll end with this quote: the only way to beat cancer is to accept the reality, embrace the pain, and find the courage to move forward, one day at a time. So it's just embracing that mindfulness attitude and knowing that this is overwhelming and it's big, but we can take moment by moment and really walk through this and make our way past that overwhelming feeling.
My name is Al Cheverine, and I am a nurse practitioner here at the Cancer Center. And I'm going to follow Rachel's excellent presentation on mindfulness with one of the techniques or things that somebody can do, um, and it's easy to do, meditation, to help themselves uh, kind of achieve that sort of mindful state and to help whether it be with a cancer diagnosis or a family member maybe who's going through something, or actually any stressful thing that might be going on in life. So this is going to be just kind of the basics. I'm going to talk about the different types of meditation a little bit, and then some of the resources that are available both on the computer, on the phones that are accessible, and also kind of walk through just how you can get started where you're at home or anywhere, just to be able to sit and kind of be mindful of your breath and breathe. And a little bit will cross over a little bit of what Rachel was just doing. She did an exercise there that was really kind of a guided meditation. And I'll talk a little bit about that here in a minute. So first, what meditation is, and it is a practice that's been around for thousands of years. Uh, we mostly think of it coming from Buddhism, which is true. It may well be where it first sort of got formalized, but it also has certainly been accepted and used in many other traditions. In Christianity, there's several different types of praying and techniques that are essentially meditation, even though it might not be called that. When meditation was brought here to the West, it mostly was brought uh, not so much from a religious or philosophical standpoint, even though it had foundations there, but more just as a secular way to achieve mindfulness or do uh, other work for the mind to focus on things. So on this screen, I also listed some of the things that can be used or achieved through meditation, including getting a new perspective or on a stressful situation. Certainly, our patients with cancer or those of us helping to take care of them can relate to stressful situations. Building skills, increasing self-awareness, focusing on the present, which is a big part of mindfulness and what we're going to talk about here with meditation. But you can use it to increase imagination, increase patience and tolerance, and also, I apologize, my screen had a problem there. Also can use it, as Rachel was talking about, for physical benefit. So it can lower the heart rate, it can lower blood pressure, and certainly can improve sleep quality and get better rest. So some of those things are a little more advanced, and today we're going to talk more about just basically mindful meditation and focusing on the breathing. What meditation is not is certainly expensive. You don't really need anything to begin a meditation practice. Certainly, there are lots of things out there that can be purchased. There's any number of websites and retail places that will sell you things that will aid in your meditative practice, from whether it's incense or different cushions to sit on or different things that are available, but you don't really need any of that. You can get started with a comfortable chair at home and begin a practice without spending a dime, really. It's not hard to do. It's as simple as focusing on your breath. Certainly, there are many more advanced meditative techniques and things that are available. Um, and as somebody moves along through their practice, they may want to focus on those. Um, we have lots of research, and in my references, there's a couple of things listed. A book in particular um, talking about training your mind and changing your brain. And there are lots of advanced meditative techniques that Buddhist monks have used, others have used to literally change the way that they both function and the way their brain functions. So it can be a very advanced, but it can also be very simple. Um, the other thing meditation is not is incompatible with, and I put fill in the blank, it's not incompatible with uh, almost anything. So if you're on a treatment for cancer, you can add meditation to it and get some benefit. If you believe in a certain religious belief, you can add meditation and it's not incompatible with any type of religious belief. And it's not incompatible with any other philosophical or ways of being in the world. So it's something that is inexpensive, easy to do, and compatible with pretty much everything. So there's two basic types of meditation, sitting meditation, which is what I'm going to focus most on today, and moving meditation, which Rachel mentioned as well. Moving meditation includes meditating while walking, certainly several of the martial arts like Tai Chi and yoga practices often involve types of meditative components. And those are all wonderful and can be very beneficial, and there's lots of great information about those out there. But what I'm going to focus more on is sitting meditation, and sitting meditation actually comes in two forms as well, that with a guide or that without. Guided meditation, which one of the exercises Rachel did was kind of a guided meditation. There's lots of great practitioners who can help you with that, many of whom have guided meditations free on the internet. One that I have used, a person that I have used some of her guided meditations, is named Tara Brock, and she's easy to find on the internet. She has dozens of guided meditations from less than a minute through 30 or more minutes. And each one is focused to do a different thing. So I will say there's lots of things out there to look at on that, and you're certainly welcome to do that. Meditation that is not guided is sometimes done with vocalization, either with a repeated phrase or with just some humming or creating a vibration. Again, those are out there. You can look into that. But today we're going to focus mostly on just sitting without vocalization, unguided, and just kind of using it to focus your mind and focus on your breath. So, besides the guided meditations that I mentioned earlier, there's also so many apps that are available on your phone. Some of I've looked at, some I have not, many I have not. Again, there are lots that are good out there. Many of them require purchases, and they may be wonderful, but I don't necessarily think you have to start there. You can certainly get into a meditation practice without having to spend on an app like that. There are some apps that are out there that are nice because they are simply a way to set up a timer to allow yourself to get into the meditation and then be reminded, maybe I want to just sit for 5 minutes. You can do that as a timer. But honestly, you can just use the timer on your phone that comes free on your phone and do the same kind of thing. And it just kind of gives you a way to end and have free your mind of focusing on, oh, I have to remember to look at the clock, that kind of thing. And then I put on here about practicing without perfection. So we talk about a meditative practice, and often when we're growing up, whether we're starting a sport or an activity or learning maybe an instrument, we often hear this phrase, practice makes perfect. And we hear that a lot in the West, especially because we have such a competitive society and that we want to achieve a certain level of something. But I like to talk about meditation as a practice without perfection, because it's just as the phrase often goes, it's about the journey, it's about the doing, and not about achieving X, Y, or Z. So I put up there practice without perfection because really it's just finding the time, sitting, focusing on your breathing, and doing that is the reward in and of itself. It's what will benefit you. So how can we begin kind of where you are? So I put this picture up here because a lot of us, when we first think of meditation, think of the lotus position, which this woman is in, and that's a wonderful thing if you can sit that way. I cannot. Many of us have bodies that don't allow us to sit on the floor, don't allow us to uh, bend in quite that way. If you can do that, it's a wonderful way to get yourself into good posture, but you don't have to. So the keys I'll go through kind of quickly are up here on the screen, and then I'll walk through each of them a little bit more in detail. So we want to achieve good posture. We want to achieve relaxation, but with attention. We want to allow for full body breathing. And we want to remember that we can't stop thinking, right? So meditation, one of the things it's not is a way to turn the brain completely off, but instead it's a way to focus yourself. So let's talk about this in more detail. Good posture. Certainly, like I said, if you can do lotus, that's a great posture for meditating. It gets the spine straight. It gets the diaphragm allowed to be kind of wide open and good deep breaths. But you might not be able to do that. So any chair you can sit, and as long as your feet are flat on the floor and your back is upright as much as it can be, given maybe limitations that you have, uh, is perfectly fine, and you can achieve good posture in that way. If sitting for long periods is not possible, laying is fine. You can lay flat and meditate in that position. So finding a good posture that you can do and maintain is important. But what that posture is not necessarily um, the biggest thing. So relaxed with attention. So we want to find a position that is comfortable, but not so comfortable that you're just going to fall asleep. So upright with your back straight, but allowing for your muscles to all just kind of sit and relax. And as you can probably see, I talk a lot with my hands, but when we're meditating, we want to find a position even for our hands that's relaxed and just comfortable. So in the picture on the screen, she's got her hands just flat on her knees, which is a great way to sit. You can have them just folded in your lap. If you've seen other pictures of the Buddha or others meditating, you see them doing other positions with their hands. Those are more advanced practices, but anything that just allows for your body to be relaxed and but attentive on your mind and your breathing is the right position for you. And then the full body breathing. So what Rachel was talking about is so important to think of when you start doing some meditation to focus on your breathing, right? So you have your back straight, you allow for your diaphragm to move up and down freely. And when you start your very first breaths, you're going to think about, I'm going to breathe in through my nose and out through my mouth. I'm going to start the breath down in the diaphragm at the core, we call it. You're going to take that breath in just as deeply as you can. You're going to fill the abdomen and then up through the chest. You can hold it. You can hold it for a few moments, or you can just pause at the top, we call it, and then exhale. And the important thing on the exhale is to remember you're going to exhale as slowly as you inhale. So it's just a nice, gentle inhale. Hold it, and then a nice gentle exhale. And you want to be thinking about how you're breathing. And this is where the mindfulness comes from. You're focusing just on the breath itself. One of the best uh, meditations to get started on that's not guided was created by a Zen Buddhist monk, actually, who just died recently. He's Thich Nhat Hanh. And that meditation is simply as you're breathing in, you are thinking about breathing in, I am aware, I am breathing in. And you pause, and as you exhale, breathing out, I'm aware that I'm breathing out. And you can vocalize it or not, but it's something that he used as a introductory, as a way to get somebody started on mindful meditation. So we're getting started, and there's this whole thing about the brain and what it's doing. So we can't shut the brain off. We're going to keep thinking, but it's what we do with those thoughts. Okay, so often when somebody first starts meditating, they're going to take maybe a first breath, maybe even a second or third, and they're really focused on it. But all of a sudden, thoughts start happening. And before they know it, they're following a thought process, and they're thinking about, oh, I got to pick up groceries tonight before I go home, or whatever it might be. And you can't stop that, right? The brain's going to keep thinking, but we just have to kind of get to a place where we're focusing on the breath and we're allowing thoughts to come and go. And the amazing thing is the more you do it, the easier that becomes, and for longer periods. And so maybe 15, 20 seconds, 30 seconds is all that we can do to start. But down the road, it becomes a couple minutes, it becomes 5 minutes. And really, I think at that point, when you're practicing and you're getting yourself to where you're following your breath and you feel how it's relaxing you, and you're understanding what it can do for you, that's when guided meditations might become a good thing, because now you're kind of advanced up a little bit, and you can bring somebody in who can walk you through a longer meditation and how to go about that. So um, these are the basics, the guiding principles of of mindful meditation. And I want you to keep in mind this quote from another Buddhist monk. And what he's talking about here is that breath is certainly, of course, a big part of it is the respiratory system, but the breath is the start of everything, right? And it's how the whole body can function and get what its needs. So he says here to think of the breath as a whole body process. It's not just the air coming in and out of the lungs, it's the flow of energy throughout the body. It's related to how the bloodstream works, right? The bloodstream picks up the oxygen from the lungs, gets it to everywhere else in the body, gives the body energy. And so to be sensitive that the whole body is involved each time you take a breath, and the whole body benefits each time you take a breath. So what this can and can't do, it can be added, like I said, to anybody's life. They can use meditation to get to a more mindful way of being. They can focus on the breath. Certainly can help with stressful situations and benefit you in many ways. And then lastly, I also put some resources up here, as well as my information. If you want to email me at any point, or certainly stop me if you're here at the Cancer Center to chat about this, I'd be happy to.